Hi everyone, it's Dr. Jill from Healthy Kids Pediatrics checking in. You can see I'm not with Dr. Torres and Dr. Nam today because due to the high demand of sick visits, I couldn't pull all three of us away from seeing patients to talk with you. But we did think it was very important to check in and let you all know that we are obviously experiencing a higher demand of sick visits, especially with the kids going back to school. And we wanted to let you know that we are aware of what's going on. We're aware that children with a sniffle are being sent home from school. Daycares are not keeping kids in because there's a fever, a symptom here and there. Now we know that in years past, you stay home for a day, you get a note and you go back. But with COVID and the pandemic, we're all aware that everything has changed, the landscape has changed, the playing field has changed. And this is causing all of us to have to work harder as a whole community to make sure that everyone stays safe, the kids still stay in school, and parents still stay sane and still able to go to work every day. So this has really been a very big balancing act. We wanted all of our families to know that we pride ourselves on families who are informed and rational when it comes to taking care of children and bringing their kids in for visits. However, with the current climate, we're not able to be rational. We have to kind of change the way we do things. So we do understand that you have a cough for one day, you have to be seen so that your child can get back to daycare or school with a negative COVID test so that you can get back to work. We understand all of this and we're doing our best to accommodate everybody. But as you know, we have 4 exam rooms, we have 3 providers, and there's 24 hours in the day. And while we're doing our best to accommodate and triage all of the patients, we just can't seem to get to everybody every single day and keep this as your medical home where we see well visits and do proper vaccine management and medical care as well. So what are we doing at Healthy Kids Pediatrics to keep our families safe, to keep our staff running on all cylinders, and to keep our patients back in school and in daycare as safely as possible? Well, we're increasing provider hours in the office. We're not changing the hours of the practice being open, but we're adding a few more hours here and there for providers to see sick visits. We are changing our well-known feeding nook into a makeshift exam room for sick visits and to give children their flu shots so we don't take away from rooms where other children are and have backup in the waiting room, because we're trying to still respect that social distancing. We're still asking families to call from the car when they arrive so that we don't have too many people in the waiting room. And we're still obviously cleaning diligently between each patient, and our cleaning staff is coming 1 to 2 times each week to do a deep cleaning so the office stays safe for all of you. In addition, Healthy Kids Pediatrics and other practices around the whole entire country are urging the American Academy of Pediatrics on local levels as well as the national level, in addition to departments of health in each state, to change the rules of what requires a child to stay home. In other years, as we know, you stay home until the child has a fever-free day and then they go back to school. With COVID, there's so many more rules, and we're trying to get them to be a little bit different so that children can stay in school and our families are not missing so much work and school because of all of this. So please know we're reaching out. I'll keep you posted when we know more. And as of right now, let's stay safe and stay healthy. Take care.